Have you ever wondered what causes an ingrown toenail? I'm going to demonstrate in this video how we remove an ingrown toenail, as well as explain what the most common cause is. And if you saw it in the beginning of this video, you're right. It's that small spike that's growing off the side of the toenail. So let's talk about what causes that. Well, patients try to remove the corner of the toenail that's growing into the skin because it's becoming painful. Well, what starts that from growing in? Well, it's hard to explain. Sometimes it just happens in people, and sometimes shoe gear can cause it from pressing on the side of the toenail. And you can see here, that's what we're doing. We're popping out that corner of the ingrown toenail. But what you're going to find very interesting is when we get this portion of the toenail out, there's actually going to be a spike on it. And what's causing that spike? It's not the toenail growing that way. It's from the patient cutting the side of the toenail, and then they think they got the entire portion that they're cutting, and then they pull, and they miss the small part that's growing into the skin on the side of their toenail. So what we're doing here is we're cutting all the way back under the cuticle because we have to remove that entire 2 to 3 millimeters of the side of the toenail. And get ready, you're going to see it right here as we use a pair of hemostats to twist out this portion of the ingrown toenail. And as it comes out, you're going to see there's a little spike there. See that small spike off to the side? That's what the patient missed right there, and it's growing into the skin on the side of their toe. So you might think, well, why can't we just clip that portion out? Well, you can, but this particular patient had it done so many times that it becomes permanent. The nail is curving, growing into the side of the skin, and they can't fix it. So what we're going to do here is fix it by permanently removing the 2 to 3 millimeters of the side of that toenail. And that's what we're putting in here. This is a chemical called phenol. So let's talk again about what causes patients to get ingrown toenails. The number one cause is by inadequately cutting their toenail, as I've described here. And then most likely the second most common cause is tight-fitting shoes, and that causes pressure from the nail fold, which is the skin on the side of the toenail, and it presses up against the toenail, creating pain, inflammation, and then it creates like a snowball effect, a circular process where the skin pushes against the nail's pushing against the skin, it keeps getting more and more inflamed, it breaks into the skin, and then their skin's normal flora bacteria invades that broken portion of the skin, and it creates a small infection. Now, sometimes you'll see pus associated with it, and if you're seeing that, that's a concern. You need to get to your physician if there's drainage coming from it. And sometimes it's not that bad. Sometimes you'll just see some inflammation of the nail fold, and that's kind of what was happening here. Another cause can be genetic. I'll see younger kids that come in. When I say younger, I'm like 8 to 12-year-old range, and they keep getting ingrown toenails, and it's not from the way they're cutting it. They've inherited that incurving position or shape of the toenail from their mother or father, and they're getting the same problem. Another cause is just aging. As we age, we all know our skin tends to change, it becomes wrinkled, or it loses hydration. Well, the same thing kind of happens to the toenail. As we age, our toenail can change in shape, and as it starts to contract or curve, it pushes into the skin, and then this same process happens. So what you witnessed here is known as a matrixectomy. We remove 2 to 3 millimeters of that incurved portion. We put a chemical in there called phenol. That chemical creates a burn, and that stops the nail from coming back. We put a big gauze dressing on there, and that stays on for 24 hours. After 24 hours, the patient removes this gauze bandage, and then they start soaking it in warm water and Epsom salts. And the reason that they're soaking it is they want to keep that area clean. Sometimes it becomes so painful that they're afraid to clean it, so they ignore it, and then it can build up debris, which can turn into inflammation, which then can subsequently lead to infection. And The aftercare just typically involves a Band-Aid, Neosporin, and they'll do this for anywhere from 2 to 4 weeks. No restrictions are necessary. They can run sometimes in 24 to 48 hours later. If you have any questions about ingrown toenails, feel free to ask me in the comment section below. If there's anything else you want to see me post, let us know and we'll get those videos uploaded.